Welcome to the deep dive. Today we're tackling a topic that might sound a bit heavy at first, maybe technical, but honestly, if you care about your pets, health, dogs, cats, whatever you've got this is, well, it's pretty crucial stuff you want to know.
Absolutely.
We're diving into animal hepatotoxins. Basically, substances that can damage your pet's liver.
Yeah, hepatotoxin sounds like a mouthful, but it just means liver toxin.
Right.
And our goal today really is to break this down. What are they? How do they actually hurt the liver?
Right.
What are the common culprits, the things lurking around? And maybe most importantly, what signs should you be watching for? We're basing this on insights from animal hepatotoxins, diagnosis, and treatment.
Okay, let's jump right in then. Hepatotoxins.
Yeah.
What are we really talking about here? What makes something fall into this category?
Well, put simply, it's any substance that can injure the liver. Some can come from inside the animal's own body, endogenous, we call them. But mostly, what we're focused on here are the ones from outside exogenous things, like medications or toxins they might encounter in the environment.
Gotcha. Drugs and environmental stuff.
Exactly. And how they cause harm, that can vary too. Some damage is what we call dose-dependent. Basically, give enough of it, and, well, liver damage is pretty much expected. Predictable, sort of.
So, like, the more they get, the worse it is. A direct link.
Precisely. But then there's the other kind, idiosyncratic injury. And these are trickier. They're unpredictable.
Unpredictable? How so?
Well, it means an animal might have a really bad reaction, even to a normal, seemingly safe dose. It doesn't strictly depend on the amount. It's like some individuals just have a specific, unique sensitivity.
Huh. That sounds, that sounds worrying, that random element.
Oh.
So, okay, why the liver? Why is it the organ that gets hit so often by these substances? What makes it such a prime target?
Right. Think of the liver as like the body's main processing plant. It's central command for metabolism, detoxification. It does so much.
It's a filter, basically.
Yeah, kind of, yeah. Its position and its job mean it's super vulnerable. Everything absorbed from the gut goes straight there first. So it's constantly dealing with everything the animal takes in food, water, medications, anything else.
So it gets first crack at everything, good or bad.
Exactly. Which unfortunately means it's also first in line to encounter harmful stuff.
Yeah.
And, it's actually the organ most commonly reported for adverse drug reactions in animals. That tells you something about its exposure.
Wow. Yeah. That really puts it in perspective. So, okay, these toxins reach the liver. How do they actually do the damage? What's happening inside those liver cells?
It happens in a few main ways. Some toxins or their byproducts after the liver processes them are just directly poisonous to the liver cells. They kill them off.
Okay, direct hit.
Yep. Then other toxins work more indirectly through something called oxidative stress. It's like creating too many unstable molecules, free radicals that damage cell structures. Think of it like internal rusting, kind of.
Rusting, okay.
Okay.
That's a good visual.
And we see different patterns of injury, too. Sometimes it's mostly cell death necrosis or apoptosis. Other times it messes with bile flow, causing a backup that's cholestasis.
Cholestasis, right.
Sometimes the immune system gets confused and starts attacking the liver cells. And often, honestly, it's a mix of these things happening at once.
Sounds like a multi-pronged attack is possible. Now, we know, like you said, reactions can be unpredictable. Not every animal exposed gets sick or sick in the same way. What makes one animal more susceptible than another? What factors are at play?
Yeah, several things influence that. Age is a really big one. Young animals, say, under 16 weeks or so, their liver systems just aren't fully developed yet. They can't process and get rid of toxins as well.
Ah, okay. Immature systems.
Right. Plus, puppies and kittens explore with their mouths. Species matters too. Cats, for instance, naturally have lower levels of certain detox enzymes compared to dogs. This makes them more sensitive to things that use up an important antioxidant called glutathione.
So cats are generally more sensitive.
To some things, yes. But interestingly, dogs can actually be more prone to damage from specific toxins, like acetaminophen Tylenol, partly because they can have lower levels of that same protective glutathione in their liver compared to some other species. So it's complex.
Huh. So even between dogs and cats, big differences. What else makes a difference?
Well, overall health and nutrition play a role. A well-nourished animal can generally handle stress better.
Makes sense.
Also, if they're already on other medications, That can overload the liver or cause drug interactions.
Right, multiple drugs competing.
Exactly. And if there's already some underlying liver disease, obviously that makes it much more vulnerable. Even things like the body's antioxidant levels, or if there's too much copper stored in the liver, which happens sometimes,
Yeah.
and genetics, definitely. Plus, whether they've been exposed before, it's a lot of variables.
It really sounds like it underlines how individual each case can be. So does that mean specific breeds are known to be more at risk? You mentioned genetics.
Yes, definitely. Genetics can predispose certain breeds to problems with specific drugs. For example, some Siamese cats have trouble with a process called glucuronide formation, which helps clear certain drugs.
Okay.
In dogs, we see it quite a bit. Dobermans, Dalmatians, Samoyeds, they seem more likely to have liver issues with certain sulfa antibiotics. Dobermans also have a known issue with a dewormer called oxybenzole.
Wow.
Labrador retrievers, they seem to have a higher risk with NSAIDs, those common pain relievers. Cocker spaniels and German shepherds, maybe more issues with phenobarbital, an anti-seizure drug.
There are quite a few breed links.
Yeah, and then you have the herding breeds, collies, Aussies, Shelties, etc. Many carry that MDR1 gene mutation, which really messes with how they handle certain drugs, potentially leading to more toxicity, including liver issues with some. And like we said, young animals generally are just higher risk overall.
That's incredibly useful for owners of those breeds to know. Okay, so let's say the worst happens. An animal's exposed and their liver is struggling. What are the red flags, the warning signs we should look for?
Okay, signs can vary. They might pop up really fast after a sudden exposure, or they could develop slowly, over time with lower level chronic exposure. Getting a good history is key. Any new meds, supplements, any chance they got into something weird.
Right, playing detective.
Exactly. Owners often first notice just general signs. The pet isn't acting right, lethargic, maybe hiding, just seems off. Loss of appetite is a big one, what we call hyperexia. Vomiting, diarrhea, those are common too.
Okay, the usual sick pet signs.
Yeah.
Anything more specific to the liver?
Yes. Jaundice is a major one. That's the yellowing you might see in the gums, the whites of the eyes, sometimes the skin. It might take a couple of days, maybe 48 to 96 hours after exposure to really become noticeable, though.
Jaundice. And what might a vet pick up on during an exam?
Well, during the physical exam, the vet might find things like a body temperature that's off too high or too low. They'll note the vomiting or diarrhea if it's happening. Weakness is common, and definitely looking for that jaundice is key. In more severe cases, thankfully less common, they might feel fluid buildup in the belly that's ascites. And really serious signs involve the brain hepatic encephalopathy. That's when the failing liver affects brain function, causing confusion, stumbling, maybe even seizures or coma.
That sounds terrifying.
It is very serious. And sometimes really bad liver damage can mess up blood clotting, leading to a condition called DIC. You might see tiny red spots on the skin, petechia, or unusual bruising.
Okay, definitely signs that mean immediate vet attention.
Mm-hmm.
Let's talk culprits now. You said almost anything foreign could potentially cause damage, but what are the usual suspects, the things owners should really be aware of?
Right. The list is potentially huge, but we can definitely flag the common offenders. Medications are a big category. Acetaminophen, Tylenol, Panadol, that's a major one, especially toxic to cats, but also risky for dogs, linked to that glutathione issue we mentioned.
Right, the pain reliever.
Yes. Then certain other drugs. Anabolic steroids, some antifungals like the azole drugs, amiodarone for heart issues, amoxicillin sometimes, azathioprine, which suppresses the immune system. The list goes on.
What about NSAIDs? You mentioned them with labs.
Yes, NSAIDs, non-steroidal anti-inflammatory drugs. Very commonly used for arthritis and pain in dogs, but they definitely carry a risk of liver and kidney problems. Even things like glucosamine supplements, which seem harmless, have occasionally been linked to liver issues in dogs.
Really? Glucosamine?
It's rare, but reported. Other drugs too, grisafulvin for fungal infections in cats, ketoconazole, another antifungal, mebendazole, a dewormer in dogs, methimazole for thyroid issues in cats, CCNU, a chemo drug, cyclosporine. Diazepam, or Valium, can be rough on cat livers. Phenobarbital for seizures in dogs.
It really drives home the point about never giving human meds without checking, or any med without vet supervision.
Absolutely critical. Even prescribed meds need monitoring.
Okay, what about things just out there? Environmental toxins, stuff in the house or yard.
Good question. Plenty of risks there, too. Certain mushrooms are famously toxic Amanita species. The death caps are notorious liver destroyers.
Mushrooms, okay. Scary.
Mm-hmm. Aflatoxins and other mycotoxins, those are molds that can grow on grains, nuts, improperly stored pet food. Very dangerous for the liver.
Moldy food, got it.
Blue-green algae cyanobacteria blooms in stagnant water, ponds, lakes in warm weather, can produce potent hepatotoxins, super dangerous if ingested.
Right. Hear warnings about that in the summer.
Definitely. Even household stuff. Cleaning products with phenolic compounds can be bad, especially for cats who struggle to metabolize them. And some plants. Sago palms are quite popular, but the seeds, even the leaves, are highly toxic to the liver.
Sago palms, okay, note to self.
And heavy metals too. Lead, zinc, arsenic, copper, iron if they get into too much somehow.
Wow, lots to be mindful of. The source material also mentioned endotoxins. What's that about?
Right, endotoxins. These are basically toxins released from the cell walls of certain types of bacteria, especially gram-negative bacteria, often found in the gut. If there's, say, a major gut infection, or if the gut lining becomes leaky, these toxins can get into the bloodstream.
And head for the liver.
Exactly. They travel to the liver and can trigger significant inflammation and damage. It's often a secondary complication of another problem, like severe intestinal disease, or sometimes food poisoning bacteria like staph or salmonella.
Interesting link between the gut and the liver there. And finally, you mentioned nutritional and herbal things. It seems counterintuitive that natural stuff could be harmful.
It does seem that way, but it's a really important point. Natural doesn't automatically mean safe, especially for pets whose metabolisms differ from ours.
Good point.
There are quite a few plants and herbal supplements known to contain liver-toxic compounds. Some traditional Chinese herbs have been implicated. Comfrey contains pyrrolizidine alkaloids, which are bad for the liver, chaparral germander. Even things like green tea extract in high doses, or lipoic acid supplements, which can be toxic to cats. Pennyroyal oil is a classic example of a toxic natural remedy sometimes misused on pets. Kava, pava in dogs.
So really need to be careful with supplements.
Extremely careful. Always, always talk to your vet before giving anything new, herbal or otherwise. And we absolutely cannot forget xylitol.
The artificial sweetener.
Yes. Found in sugar-free gum, candies, baked goods, even some peanut butters now. It is incredibly dangerous for dogs. Causes a massive insulin release leading to low blood sugar, but also causes severe, often fatal liver failure very quickly.
Xylitol. Okay, keep that far away from dogs. So besides direct exposure, what else increases the risk? Are there background factors?
Yeah, we sort of touched on this, but definitely worth repeating. If an animal is already on medication that affects liver enzymes, either speeds them up or slows them down, it can change how they handle other potential toxins.
Like drug interactions again.
Right. And, as mentioned, any pre-existing liver condition just lowers the safety margin. The liver doesn't have as much reserve capacity to cope with an additional toxic hit.
Okay. This has been, wow, a really thorough look at these hepatotoxins. It's certainly clear the liver does a massive job and faces a lot of potential threats. For everyone listening, what's the main takeaway here?
I think the biggest thing is awareness and being proactive. Just knowing these potential dangers exist helps you minimize risks around your home and yard.
Right.
And it helps you recognize those early warning signs if something does happen so you can get help faster. The liver's tough, but it has limits.
Absolutely. And this deep dive, it was really focused on pulling out that core information from the medical resource, animal hepatotoxins, diagnosis and treatment.
Exactly. So if anything we talked about today sparked a concern, made you think, maybe I should check that out about my pet, please, the best thing you can do is talk to your veterinarian. They know your pet's history. They can give personalized advice.
Definitely the crucial next step. And maybe just a final thought to leave everyone with. When you think about the sheer number of potential liver toxins we've touched on, meds, plants, foods, chemicals, what are one or two concrete, proactive steps you can take starting today in your own home or routine to make your pet's environment just that little bit safer from these risks? Something to really think about. Thanks for joining us for this deep dive.